Hi everyone, this is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It is 2:30 p.m. on Thursday, September 17th. Today, in addition to our usual public health updates from Nita Ludwig of the Rock Island County Health Department and Ed Rivers of the Scott County Health Department, we're going to have two child care resource and referral experts talk about navigating child care in the time of COVID and beyond. First of all, Nita, let's start off with some numbers. Thank you.
Good afternoon. Today, the Rock Island County Health Department is reporting 40 new COVID-19 positive cases, bringing our total to date to 2,789 cases. There are currently 17 people hospitalized in Rock Island County with COVID-19, and the death toll stands for Rock Island County at 74 deaths. We are seeing higher case counts this week, which could be associated with Labor Day gatherings. We have seen jumps in cases after every summer holiday this year. If you believe you have been exposed or know that you attended a gathering without taking proper precautions, please get tested. There is a state-run testing site open 9 a.m. to 5 p.m. every day through this Sunday at the Quad City Expo Center in Rock Island. Any Illinois resident, regardless of symptoms, can get a free test at that site. Thank you.
For Scott County, today the Iowa Department of Public Health reports 2,612 cases. They have also reported the death of another Scott County resident, bringing our total to 27. Our deepest sympathies go out to the family of this individual. As a community, the challenges related to COVID-19 just keep on coming. On both sides of the river, families with children are dealing with the difficulties of responding to a new school schedule, taking on the role of a home school teacher, navigating the world of technology and connectivity, balancing job responsibilities and schedules, and also finding safe ways for caring for their children while they're not in school as usual. For many families, this is not only a scheduling issue, but a financial and safety issue. We're fortunate enough to have dedicated programs in our community that are responding to the needs of families in these unique times. Child care resource and referral programs in Scott and Rock Island counties are champions for families, and we're fortunate to welcome staff from both programs on the call with us today.
Thank you, Ed and Nita. So today we do have two of our child care resource and referral community partners on the call. They will be using some slides to share some information with you. So first we will hear from Becky White, Regional Director for Child Care Resource and Referral of Southeast Iowa, and that's through Community Action of Eastern Iowa. So Becky, feel free to go ahead and share your slides.
Hello, good afternoon. My name is Becky White, and I'm the Regional Director for Child Care Resource and Referral of Southeast Iowa. So I'm here today to update you on some of the information and data about child care programs in Iowa and how they've been affected by COVID-19. So Iowa DHS continues to provide updated guidance to child care providers to ensure the health and safety mitigations is taking place within the child care settings. This has continued to evolve over the last 6 months, and currently, here's some of the current recommendations that came out in August. So currently, adults and children school-aged are encouraged to wear face masks to help limit the spread of droplets. Other younger children over the age 2 are also encouraged, but they've put a stronger emphasis on that school-aged child. The programs are using social distancing by reducing class sizes and limiting the number of people allowed in communal places at one time. So for example, this would be on the playground or in hallways to make sure that classrooms are not, moving into those communal places or spending time together. Though the class The class sizes through the summer were limited to no more than 10 in a class, but that has been lifted and is based more on room capacity. And so centers are encouraged to evaluate the room capacity and making sure that programs or children and teachers can socially distance within that classroom. There's other mitigations then that are emphasized, including frequent hand washing, cleaning of materials, minimizing the sharing of high touch materials. So for instance, toys that maybe are frequently used, having additional sets of those or additional materials available. Another high touch item is food preparation. And so making sure that programs are planning and being prepared to serve food individually to children. So normally pre-COVID, we would encourage family style and passing the food and those self-help skills of serving yourself. And those are kind of a thing of the past at this point. So really encouraging programs to be planful and make those mitigations. One of the big questions that comes up is about what happens if there's a positive case or exposure to a person who has tested positive. So the Iowa Child Care Nurse Consultants and the Department of Human Services, DHS, have provided some guidance to programs which includes basically contacting that nurse consultant to share the situation and ask for additional guidance and directives. So programs with an identified case or exposure would follow the CDC guidelines. Those individuals that had close contacts would be asked to quarantine if they were, in that close contact with persons that had tested positive or had been exposed. And then DHS provides some additional steps that programs can take to make sure that they are being preventative. They do make the determination to close programs if there is multiple people testing positive or a situation where they believe that, that there was a widespread close contact. Many programs we're seeing are taking that step if they do have someone who tested positive, that they're closing for a few days to deep clean and ensure that all precautions are taken and that they're ready to reopen. Childcare continues to be a need in our community. So with school programming returning to hybrid or remote learning, families are looking for childcare for non-school days so they continue to work and provide for their families. Once again, providers, both homes and centers, have stepped up in attempts to fill these needs. They have adapted their enrollment, created age-appropriate activities for school-age children, and many have helped create solutions for virtual learning. So though many programs have school-age children normally in care, they are not prepared to provide full-time care year-round because the children are typically in school. So that's taken a lot of adjustments. Virtual learning has created many barriers, such as internet access, supervision of when those children are online, making sure that they're looking at the right content and following their lessons, and then the need for teaching of that lesson or school-age curriculum. Again, our child care providers' experience and expertise tends to be with infants, toddlers, and preschoolers, especially when it comes to that education tool, whereas school is that primary teacher for those school age. This has been a stressor for the child care community, but providers continue to try and meet the needs of all the children in their care. And that's kind of the key, is they step up and know that they try and figure out what's best for that child. Families looking for care for school-age children or any other ages are encouraged to call our parent referral services. So the number is on your screen. Similar to Illinois, our parent specialists gather information based on the family's needs, including ages of the children, hours of care needed, and location preferences. Based on the gathered information, we provide parents with a list of possible childcare programs, as well as information regarding the selection of quality childcare, and give them some questions that they should ask programs when they're trying to find a provider that meets their family's needs. There is also a resource online that shows childcare programs and vacancies created by DHS in conjunction with Child Care Resource and Referral. And this is to help families and communities identify availability. So this is kind of a screenshot of what the map would look like, but you can zoom in onto specific areas to see how many vacancies are listed in there and what programs. So Scott County had 297 total programs listed with Child Care Resource and Referral in July of 2020. That is compared to 312 in July of 2019. This includes the The number for July 2020 includes approximately 40 programs that remain closed at the end of August of 2020. So those are programs that closed due to COVID back in March and are temporarily still closed. Some of those programs may have opened up at the beginning of September with schools opening, and so those numbers will be reflected at the end of this month. Others are unsure if they'll be able to reopen and what that looks like for them. The last thing I wanted to share with you today is just about the need for support of our childcare programs. Iowa had already lost 40% of childcare programs over the past 5 years, so that's looking at 2014 to 2019, including 40%, the same statistic in Scott County. So now more than ever, our childcare programs are struggling to stay open. So on top of that loss, we're concerned about programs that maybe aren't able to stay open or will not be able to reopen after this pandemic. We did a recent phone survey, as did Illinois, and April can share that, but some of the programs in Scott County area, and they have continued to express worry over financial needs of their program with reduced class sizes and higher expenses for things like cleaning and staffing. They express concerns about the amount of income compared to the amount of costs running their programs. And that is for both centers and homes. Additionally, they're struggling to find the staff to care for the children within the programs. And this has been noted by the programs to be due to fear of providing direct care during the pandemic. So finding staff that maybe didn't want to return to work or feel like they are unable to due to their own health concerns, as well as hiring new staff into the field has become difficult. Other reasons for that have been staff or potential staff needing to be home to help care for their own children and their own children's learning. So I thank you for your time today, and I appreciate your interest in childcare and the children in our community, and am happy to answer any questions that you have and gather that information. Thank you.
Thank you so much, Becky. We really appreciate you sharing that information representing the county. And now we are going to hear as well from our other resource over in Illinois. This is April Berthaiume. I don't know if I said that correctly. I apologize. I should have asked you first, but Child Care Resource and Referral Director with SAL Family and Community Services. So please go ahead. Let's get you unmuted there really quick, April.
Thank you. We were both trying to unmute me at the same time there. Thank you. Good afternoon. My name is April Berthaiume. I'm the Director of Child Care Resource and Referral of Midwestern Illinois, located in Moline. This afternoon, I'm going to just talk with you a bit about this response of Illinois within respect to the COVID-19 health crisis, including some measures that the state has taken, current regulations and guidelines that are in place to help ensure health and safety, and also some additional resources that our office does provide here. I'm talking about Referral, Midwestern Illinois. Our office is located in Moline, Illinois. However, we do serve a 7-county area here in the western area of Illinois, Rock Island County being one of those. Our services include child care assistance program management. We do offer provider services, some various grants and programs, and we also do parent referral services. Information here around just a little bit of background on Illinois' response to the COVID-19 crisis. Included in Illinois Governor Pritzker's March 21st emergency order was the closure of all licensed child care centers and homes, as well as the closure of legally licensed exempt centers outside of schools. However, the state did have a mindfulness of the need of continued care for critical emergency services, even amidst the really vast scale of closures that Illinois saw within our planning. Within this, child care programs, while closed within this emergency order, they were allowed to reopen under a status of an emergency child care site. Within this emergency child care site designation, these programs were allowed to serve workers that were defined by essential workers. Those definitions were within our emergency rules. With the movement of Illinois into phase 3 of the Restore Illinois plan, all programs have been allowed to resume child care services. It's of course up to the individual program if they chose to open, but they are allowed within state regulations to reopen. There's a gradual reopening approach that has taken place as outlined in the Restore Illinois plan, and Illinois is currently in phase 4 of this plan. So information around what this reopening has looked like. We really have two components of this. The first is the Illinois DCFS, Department of Children and Family Services licensing regulation requirements. The Illinois Department of Children and Family Services, they are responsible for licensing oversight and enforcement of these regulations. So I'm doing some general report out here. This is a different agency in Illinois that manages this piece. But some general information around what's in these requirements, in these regulations, is prior to reopening, licensed programs are required to submit a reopening plan to the Department of Children and Family Services representative. And this plan needs to give details around how a provider intends to meet the new health and safety standards that are in place. Some examples here require daily health checks for all persons entering program, and really encouragement of only essential individuals, so children, families, and even with families that there's really limited entrance at drop off and pickup, as we're really trying to keep as many people out of those programs as we can so that we can maintain our essential services to children. There's cleaning procedures throughout the day at closing between shifts that are required. Also within that emergency plan, there need to be plans to provide PPE for all staff and children, as well as training for staff to make sure that that PPE is used appropriately. Enhanced staffing plans are also required. Within Illinois requirements, children are required to be kept within the same group. This would mean if you're in a childcare home, within that childcare home setting, but if you're in a center, this really is typically broken up by classroom. So they're required to stay within the same group and with the same teacher or staff throughout the entirety of the day, once again, so that we're doing whatever we can to really reduce the number of individuals that exposure for both staff and children have throughout the day. Group sizes have been reduced as well within these new DCFS requirements. We see approximately across the board 70% capacity. The capacity of a program or the number of children that can serve is dependent within those requirements, some baselines, but also there's some measures there within square footage to ensure that within a classroom, social distancing is able to be maintained. And as mentioned, groups cannot be combined throughout the day. This includes not only classrooms, but like shifts within playgrounds and those sorts of things to make sure that we don't have any those groups mixing. So those are requirements that are within the Department of Children and Family Services within that emergency plan. We also have some Restore Illinois Child Care guidance that we've been given. This is where we really want to see best practices taking place, and this is within that Restore Illinois Child Care guidance plan. This is also really within conjunction of requirements. This includes social distancing practices that need to be in place. Also effective August 7th, the Illinois Department of Public Health did issue emergency rules mandating the wearing of face masks, and this mandate is included in Illinois within childcare settings. Within those Illinois childcare settings, face coverings are required for all children and staff over the age of 2 in all licensed centers, homes, and licensed exempt center and programs. Concessions are available for those that are medically unable to wear them, but the general rule of thumb is that it is a requirement. The face coverings, they can be removed while eating, while drinking. They can be removed while the children and staff are outdoors. And staff can also use face shields to allow for facial visualization during instruction. There were concerns as we're talking about the development of children, especially as we're talking about very young children and that reliance that they have on seeing, as they're learning language, on seeing how words are formed with mouth and just facial reactions, and there's so much learning that takes place within early childhood. So we want to make sure that we are still encouraging that where we can. So this is where this face shield allowance is very important. There are also hygiene and health practices that are in place, an example of which in Illinois during nap time or during sleep time, children must be 6 feet apart from each other while sleeping, or there must be a non-permeable barrier in place that was specifically has been developed for that use. Within this guidance as well, centers that are exempt from licensure are currently under expanded allowances that allow for the provision of services for school-age children during remote learning days as specified by local school districts. This is very important as these license exempt centers typically may have been able to operate in a full-day status. This is all very dependent on what their exemption looks like. But with this expansion, we have expanded ability to serve these school-age children. As far as connecting families with childcare services, our services in Illinois look very similar to those that Becky talked about in Iowa. We have our parent referral services. Any family is able to access these services. So if a family in Illinois is trying to find a childcare center, a childcare home, they can contact our offices, and our parent referral specialists will work with those parents to identify the best childcare fit for their families. As we know that really every family situation is really as unique as that family. So we help to provide those tailored services and really help to families to find best fit. We have parent education services as well. Within this is as parents have questions. It's one in any time really, not even just times of crisis. One of the hardest decisions that a parent really makes is who's going to care for my child. So our services work to help that parent to be as prepared with education as possible around different care environment types. What are the questions they should ask? What should they look for as they're looking for quality care? So these are not just emergency, these are regular services that we provide, but are especially important now as parents just have so many questions. Within the state of Illinois, the Child Care Resource and Referral agencies, we are responsible for the management of the Illinois Department of Human Services Child Care Assistance Program. So for families that are in need of assistance with paying for childcare, this program is available to really help families to afford that cost. Our programs have eligibility requirements, including income eligibility and participation in eligible activities. Some more information on that's on the screen here. For income eligibility, and this is generalized information. Every family's really situations are different, so we always encourage families to talk to our office and talk to our specialists to determine eligibility, but some basic overviews here. Income for a new application must be at 200% or below federal poverty level for a family to be eligible for the Illinois Child Care Assistance Program. And within Illinois Child Care Assistance Programs, all families do pay a portion of a cost of care as co-payment, and that amount's based on income, on family size, and families can be approved for full-time, part-time, or before and after school care. Eligible activities for Child Care Assistance Program, these include that parents or guardians must be working and or going to school. There's some more information within that, but those are really two basic components, is that working and or going to school. And if questions on eligible work activities, eligible school activities can be directed to our office as well. So just some information here. One of the really hot questions in our community right now is around school age access to care. We're just really in this, as we all know, and those of us who are living this really do know, with the blended and the hybrid school models that we see in place here, access to school age care. Becky talked about this, just really great here is that we have systems in place that have been built around these full school days. We have systems that have in there on early closure days and those sorts of things, where there's measures in place. But looking at this movement of children from being within school care settings during a school year and moving them into childcare has really been a big deal for our field as we're trying to really adapt quickly, but there's that balance of adapting quickly but also maintaining health and safety guidelines. Licensing requirements are really in place for a reason, and even when we look at license exempt care, which is what we call this in Illinois, there are measures to be taken, exemption requests that need to be made. So our field is working to adapt, but we need to make sure that children are safe. I'm just giving a little snapshot here for Rock Island County. 2018 census data shows that we have about 11,700 children in Rock Island County between the ages of 6 and 12. We looked at our office worked to crunch some numbers with the information that we have, and pre-COVID slots. And when I say slots, this is the number of available slots within a childcare, or sorry, within our community. This is not vacancy. So it could be that these slots are full, but this is the capacity of the community to serve with 981. However, our current estimates are at 651. So we see anywhere from a 60-70% capacity from what we saw before. Not including these numbers, one area that we see growing really fast right now is what we would consider license exempt care. There's and with some license exempt centers, we see coming up, and these are those programs that you might see within like schools and churches and just community-based environments that are not under the licensure requirements and need exemption categories under the Illinois state rules. So we see some information on there. This also doesn't include the friend, family, neighbor care. As we see that gap between the number of 651 and 11,700, that's a big gap. And while we know that recent data with our community shows that a number of parents have that ability to be remote and to have their children with them, but we all know very well that's not the case for all or even most families. So we the assumptions that we really draw for this are that so many children are in that friend, family, neighbor care. Within the state of Illinois, friend, family, neighbor care is eligible for payment under the Child Care Assistance Program, assuming that other requirements are met. Also, when we talk about school age care, there is a short-term rule change within Illinois where children that are in, let's say a child has a remote learning or hybrid schedule and is in a child care facility. The Child Care Assistance Program, we have some short-term allowances where right now it goes to the end of October, where the Child Care Assistance Program can provide payment for that care, assuming that a family is eligible for Child Care Assistance Program. Looks like I lost my presentation there, so you're probably seeing a picture there of my own child. So, well, we'll just end there because pretty much what I have left is just really talking about where we're at in Illinois as we move forward. You've seen our number here. Childcare sustainability does maintain to be a very high priority in Illinois. Illinois has made investments to sustain our field through one-time stipends, through investments in PPE, through investments in cleaning supplies. We've seen those in Iowa as well. Illinois has used federal dollars that have come into our state for childcare restoration grants. These are grants that are fairly high dollar grants for programs to sustain them for the next few months. But we have this short-term issue that we're looking at, but we really as a community need to be looking at our long-term issue around how do we really rally around childcare to have childcare survive and sustain in the long term. As we're just really seeing what I think Becky and I and our colleagues have known for a long time, which is the essentialness of childcare. But with these shutdowns of care, just how critical this is not only to the families that are served through childcare, but really to our economic sustainability as a community. So thank you for your time and for your interest.
Thank you so much, April, as well. We do have one request. Can you say your last name and say it slowly? I probably butchered it since I didn't ask you. So.
No, you are fine. It is a tricky one. My last name is Berthaiume.
Berthaiume.
It makes more sense if you take that I and A out. But yes, it's definitely one that takes practice.
Thank you. We do have a question here for both of you. I'll start with Becky. Could you describe some of your current demands for services for childcare? What are parents saying when they call? What do they need? And kind of comparison between what you're seeing now compared to prior to the pandemic.
Sure. So our parent referral services have stayed busy throughout the pandemic. We were very surprised in March and April how the numbers kind of had dropped of the request. We weren't getting quite as many, but the stress behind those calls was way higher. So it was families that had already tried to find care through family, friends, and neighbors, and really were unsuccessful in really feeling like they needed care, and they needed care immediately so that they could continue working. We've had a lot of families over the last 6 months contacting us, basically saying, I'm going to lose my job if I don't find that care. And so really that stress level of those families looking for care and not being able to find it has been high. As we move through the summer and where we are currently now, our numbers are pretty much probably equivalent to what we saw last August, September, as far as the number of requests, but matching those families up and families that are needing to get additional referrals is probably slightly higher just because of some of the programs remaining closed and for the uniqueness of what families are looking for. And so when families are calling us, our systems, as both April and I shared, weren't necessarily set up to provide this like part-time school care. So if they're on a hybrid learning and they need care only half-time, that system is set up, to hold a slot for the whole week. And so that's not feasible for financial reasons for programs. And so trying to work through that as a logistics thing has been difficult in helping match parents to those programs. So the number is consistent. It's just the stress behind it, as well as the type of call and the type of care being requested has changed slightly.
However, with Becky, we're seeing very similarly in Illinois. Fall back to school is always a very busy time for us for parent referrals, as parents are moving out of whatever their summer arrangements are and looking for before and after school care. Similarly, where we've actually surprisingly seen some of our referral need drop. And as we work to figure that out and really determine what's going on, what we hear and what we believe that we're seeing is that parents have for the short term figured it out. And again, that's not universal there, but what our fear is we've seen responses from employers around, or we've seen schools saying, for this first quarter, or for these next couple months. And so as employers are working with families, we are with other family neighbor care, we've seen that placement take place. We're just really trying to prepare for really what happens next, as employers can no longer maintain those remote statuses, or if schools need to stay remote or hybrid for a very long period of time, and those informal friendly resources are not quite as available. We've found that we don't have quite as many calls for infants and toddlers as we used to, so we're wondering, especially infants and toddlers and those young children in friendly neighbor care.
Thank you for that answer to that question. We did receive one additional question ahead of time. Janet, are you able to include that one for now? That was for Rock Island County, and this was for Nita to answer. I'll go ahead and do it here.
Okay, go ahead. I was looking for it again.
Yes, I think it was in regards to the press release you sent out with the case count. Of today's totals, 16 are associated with an outbreak at a long-term care facility. Are you able to provide the name of the facility?
No, we aren't able to provide the name of the facility. The Illinois Department of Public Health does give out aggregate long-term care outbreak data on their website. So I can put the link in for that link at the IDPH website for you.
Okay, thank you. And to close today, just wanted to update on one more piece of information. We do know that the Quad Cities Chamber also has some additional resources for families as well as businesses regarding the back to school balance for employers and parents. And so we will make sure to include that information in the press release that we put out after the call. So again, thank you to both April and Becky for joining us today. Today's briefing is being recorded and will be posted on the Scott County Health Department website as well as on our Facebook page. We encourage you all to join and get the information there should you have missed anything. And thank you to our media partners for joining and sharing this information. And we look forward to having more for you next week. Have a good weekend, everyone.